Hi, this is Jenny Villanova, and I'm going to be recording the NSG434 Pediatrics Childhood Immunizations PowerPoint topic, and this is a part of topic 1. Immunizations and vaccinations, these terms are used interchangeably. So whether you hear immunizations or vaccinations, don't be confused. It is exactly the same thing. We'll start off here with a nice definition of vaccinations, and it's the administration of a small amount of antigen, which is capable of stimulating an immune response, but it does not typically produce the disease. Listed here on this slide also are 5 different types of immunizations, and these are further discussed and explained in your pharmacology textbook on pages 431 through 432. Immunizations really begin with infancy. Primary schedule begins at birth, and the infant receives its first immunization, hepatitis B, usually in the delivery room right when they are born. And as I said, that is the beginning of their immunization regime, if you will. And listed here then are the various types of immunizations that the child will be getting. We start with the infancy, and then they will get various boosters at a prescribed time following a schedule. So that by the time they're entering school at about kindergarten or first grade, 5 or 6 years old, most of their immunizations have been completed, and they may have to have some boosters down the road, but usually by the time they're entering kindergarten, first grade, their immunizations pretty much completed. In your pediatric textbook on page 841 is a bit of information about this beginning of immunizations and the schedules that I was talking about. Now, since we do have various schedules for them, nurses do need to know where to obtain the information. And on the slide here, it talks about the Center for Disease Control and Prevention, or CDC, and gives a website. Now, the website will give the schedule for vaccinations and also a schedule for catch-up vaccinations. The reason we have a concept of catch-up vaccinations is that sometimes boosters may be missed, or maybe the initial immunization itself may be missed. Maybe the child's families move from one location to another, changed pediatricians. There was some disconnect in the follow-up pediatrician visit, well baby checkups, anything that could interrupt the routine of the follow-up well baby checkups after birth. Usually they're 2, 4, 6, 12 months, 18 months that the child is brought into the pediatrician for well baby checkups. And at those checkups, that's usually when they're getting their immunizations. But due to family schedules, changes in location, work, maybe relocation across state lines, etc., the ball can get dropped, and therefore that catch-up vaccination schedule may need to be brought into application. Another source also for the immunization schedule is the American Academy of Pediatrics. In fact, the American Academy of Pediatrics has a great deal of input into the CDC schedule for childhood immunizations. Schedules frequently change due to advances in immunology. As we discover and develop new technology, new immunological kinds of procedures, it may be that an improvement has been made in the immunization such that the frequency or the time at which it is initiated, it has been changed due to the new technique that's come up with that particular immunization. So the schedules are now online so that they can be changed and updated much more readily and available for the pediatricians or healthcare providers. There's also schedules for preterm infants, and preterm infant schedules are based on the chronological age. And as I discussed in the physical assessment uh, recording, do remember that for the pediatric population, we have two ages. One is their chronological age, and the other is their developmental age. So, schedule for preterm infants is going to be based on chronological age. Um, Child may fail to receive all doses, and if they do fail to receive all of the doses, we just give them the catch up. The ones that were missed are what are administered. There's no need to start all over again. So some of the immunizations, as you'll see going through this discussion today, they'll receive an immunization 1 month and then several months a second one, and then maybe several months later a third one. And if it happens that when they're in there and they're beyond that second dose, and they're at the time that they would normally be getting the third one, but they haven't gotten the second, we'll give the second one, and then we'll count the months from there as to when the third one is due. But we don't go back and start all over. Um, Also, we may have some population that we may not know about their reliability for return visit. Some immunizations can be administered simultaneously at separate sites. So if we're uncertain about their reliability or their ability to return for that shot a month from now or 6 months from now, we may go ahead and we may get a jump start on administering those. But again, that is up to the healthcare provider, and the healthcare provider will access the schedules that are available on that CDC website. So, um, hepatitis A virus is the first immunization that we're going to talk about, and this one is predominant in the daycare area simply because of diaper changes. As you can see there under the significant child health problem, fecal oral route. And obviously, with diaper changes, there's a great potential for contamination from caregiver to baby between diaper changes. Hand washing, wearing gloves, disinfecting the area between each and every diaper change are really super important. And sometimes if those specific steps of hand washing, wearing gloves, and disinfecting between each and every diaper change, if any one of those three areas are not adhered to meticulously, there's potential for the child to be exposed to hepatitis A virus. Therefore, this is a really important immunization to get started, and as you can see, they'll get their 2 doses, the first one at a year old and the second one at 6 months old. Children in daycare are in incredibly close proximity to one another, and children do indeed share everything with one another. And I think I've already mentioned hepatitis B immunization as being the one that is administered in the hospital before the newborn baby even leaves the hospital. Frequently, when I was working in neonatal intensive care unit, NICU, we would go ahead and give those right there in the Dell room while the baby's on the warmer. And it's really important to get these started because hepatitis B during childhood and adolescence can lead to fatality from cirrhosis or liver cancer in adult life. So it's really important to get started with these according to schedule. In your pediatric textbook on page 842 is further discussion about the various sites that are utilized. IM is the frequent route for these immunizations. The vastus lateralis is utilized in newborns, and the deltoid is utilized in toddlers and children. When we have an immunization, that's to be administered IM. The dorsogluteal site is avoided because there is a low antibody seroconversion rate, and that could also that will impact a reduced immune response. So we don't use the dorsogluteal because of that low antibody seroconversion rate, and also we don't use the the dorsogluteal site because of the concern for the potential for sciatic nerve damage. So dorsogluteal site is a big no-no in the pediatric population. An additional IM site that may be utilized is ventrogluteal site, but the catch-22 with the ventrogluteal site is that we don't have specific data about the seroconversion rate. So again, we're embarking on unknown territory as to the effectiveness of that site. So our best choices are IM vastus lateralis for the newborns. Pre-walking, these babies are not walking yet, and once they are up and walking, especially as a toddler and a child, we're going to be using the deltoid site. The next immunization is the DTaP, and that stands for diphtheria, tetanus, and pertussis. Pertussis is commonly known as whooping cough because the child does kind of sound like they have a type of a whoop that goes along with their cough that they have. The biggest thing is the pertussis and the diphtheria are both respiratory signs and symptoms. And again, can be quite fatal for the child. Notice on the box here that it says for pediatric use, this is a DTaP because adults can get tetanus immunizations as well. And they would be using an adult formula that would be special concentration for the adult population. So always be sure that you completely read the box of what it is that you're administering so that you're giving the right concentration of the immunization. In this case, the tetanus. The tetanus is important here because tetanus is used for the adult population and the pediatric population. Years ago, we did have a resurgence of pertussis because previous 10 years had shown that there was a decrease in the effectiveness of the pertussis immunizations. And some of you may even remember when you were about 10 or 11 years old, you may have had to get a pertussis booster. And in which case even adults were encouraged to get a pertussis booster just to make sure that that was not passed amongst in the community, because again, pertussis could be potentially life-threatening, especially when we're talking about the infants and babies. Inactivated poliovirus, or IPV, is another immunization, and the thing I want to point out here is this particular one. Pediarix is a combination vaccine, and this combination vaccine, Pediarix, combines DTaP, hepatitis B, and IPV. So it's essentially 3 immunizations rolled into one shot. And the advantage with these combination vaccines is that they decrease the number of injections that the child has to get, as well as decreasing the cost. So it's much more cost effective to use combination vaccine, as well as for the comfort level of the child only getting 1 injection as opposed to 3 injections. The next one is measles, mumps, and rubella, or MMR. And during measles outbreaks, the second dose of the MMR may be given earlier, provided at least 4 weeks have elapsed between the previous dose and the subsequent second dose. There is also a preparation that is shown here as ProQuad, and this contains measles, mumps, rubella, and varicella vaccine all rolled into one. Because of the varicella component, this is an attenuated live virus vaccine, and it should not be administered to children with immune deficiency concerns or pregnant women. Rubella is a mild infection in children. However, in pregnant women, rubella can cause serious risks to the developing fetus. And the thing is that we want to get children before puberty and susceptible adolescents and adult women of childbearing age. We want to get them immunized before they become pregnant or could possibly become pregnant, because we don't want them to be exposed. Let's see. What is going on here? I think that's, note that the ProQuad label states store frozen, And it's important that we need to keep this at a specific temperature for the storage due to the varicella, the live attenuated vaccine. So it is drawn up right at the time that it is administered. And MMR and varicella, that is the pro